All right, guys, so today we're going to review the anatomy of the fetal pig. I like to approach things in organ systems. To me, that's the best way to study this material. So the first one we're going to do is we're going to attack the cardiovascular system. All right. So the first structure on the cardiovascular system you want to pay attention to is the heart. If we had not already dissected this heart, you would pay attention to this thin little membrane surrounding the heart. That thin membrane is called the pericardium. You guys do need to know that. When we flip the pericardium back, we see the actual organ of the heart. As I tilt it down, you've got the apex of the heart down here, the base of the heart up here. If you notice the apex of the heart, you see the pointy end. You'll notice this is one section. This is the left ventricle, all right? It always takes up the very most bottom part of the heart. The next part we want to pay attention to is its compadre right over here, the right ventricle. And then if we're coming up above what looks like a crown right here, I'll tilt this pig up where you can see it a little bit better. This area right here is going to be your right atrium. And then right next to it would be your left atrium. If you're paying attention to your vessels, you'll see a little bit of a red vessel right here going around the heart in what almost looks like a crown type appearance, which is how he got his name. This is your coronary artery. If we look at the right ventricle again, you'll see there's a vessel coming out of your right ventricle. This vessel is your pulmonary artery. It's going to take blood out of the right ventricle into the lungs, hence the pulmonary part. If we flip our heart over and we pull the lungs over, we'll notice we've got another vessel coming. So just to give you guys a little bit of reorientation, this is your left ventricle. Here's your right ventricle. There was that pulmonary artery. Here out of your right ventricle, if you pay attention, you have a big vessel coming out of it. Out of your left ventricle, you have a big vessel coming out of it. Leaving the left ventricle right here is your aorta. This portion is your ascending aorta. Then you have your aortic arch, and then you dive down on the left side of the body. You've got your descending aorta. Really pretty. All right. So that goes over the heart proper. As we come over here on the right side, we have two large vessels that dump into the right atrium. They're bringing blood back to the heart. This one right here is called the cranial vena cava, or in human terminology would be the superior vena cava. This one down here coming from the bottom of the body is the inferior or caudal vena cava. Both of these dump into the right atrium. All right. If I'm taking my vena cava up and I go up, you can see it split. Where it splits are my brachiocephalic veins. And then they continue on out as my subclavian veins. If I come back over here to my aorta, this is an artery, right? When I go up from my aorta, this is my brachiocephalic trunk. And then when I look at it split, that gives rise to my subclavian arteries. Coming on up, you can pay attention to your brachiocephalic trunk on your artery, giving rise to both of these large arteries going up through the neck. Both of these large arteries are my, anybody want to help me with this? Carotid, right? These are my carotid arteries, okay? Sitting juxtaposed to my carotid arteries is going to be my internal jugular. And then if I come out a little bit, this is on the outside of the body. If I have an internal, I probably have a what, guys? External. Fantastic. So who do you think this is? External jugular. Great. All right. That is the main parts of the cardiovascular system that you need to know. Now, let's go on into the respiratory tract. Sure.